Allora, dunque, a questo punto io inviterei il primo dei due barcellonesi. Aspettiamo che si microfoni. Allora, Josep Malvehy e Susanna Puig sono arrivati ieri sera. Josep parlerà dei noduli, che è un altro argomento importante, e Susanna parlerà delle lesioni rosse, altro argomento importante e difficile. Siamo in un ambito un po' più difficile oggi. Giuseppe e Susanna sono dei vecchi amici. Giuseppe è il responsabile della Melanoma Unit di Barcellona e Susanna è responsabile della ricerca nell'ambito della Melanoma Unit. Lavorano come matti. Io non ho mai visto due persone lavorare in questo modo, quindi hanno un'esperienza straordinaria. Per cui, Giuseppe, please tell us about nodules.
Thank you so much. Buongiorno. Io non parlo italiano, ma complimenti per l'organizzazione, Jeppi. This is really a beautiful place and beautiful scenario, but this is not so nice. Noduli, because this is really challenging for dermatologists. It's a problem, nodular lesions. If you miss a nodular melanoma, this is a disaster for the patient. I'm working in a referral center, as Dr. Jeppi Argenziano told you. This is a referral center in Barcelona, you call Barcelona, but it's a very big center in melanoma. And we have patients every year with problems because a dermatologist miss a nodular melanoma. And then this is very important. This is my center, just to introduce you, where I'm working with my team. And we had the opportunity to go into this in detail, because melanoma, it's always the monster for dermatologists. It's the tumor that is killing patients. And then in this work with other friends and colleagues from different centers, we analyze the problems in the diagnosis of melanoma, the most common problems. And this is important because melanoma is one of the malignant tumors where misdiagnosed can be more important for the patient. And this, one of the main problems in this diagnosis was nodular melanoma. And nodular melanoma, why? All you know, because these tumors many times lack the clinical findings that we know for melanoma, many colors, asymmetry, etc. Sometimes the clue is that the lesion is growing fast, and this is a problem also because in 3 months, nodular melanoma become thicker, and this is important and can kill the patient in just a few weeks even. Then it's very important to take different information, all the information that the patient can tell us. Yeah. Much better now. So changes, nothing? Yes? Okay. Then the information coming from the patient sometimes is not very good, but in this case, you have to take this into consideration always. And dermoscopy. I asked Jeppi, what I am expected to do, and he told me many images if you have, because nodular lesions or nodular melanoma is not easy, and a lot of images and a lot of cases, and I will do a lot of dermoscopy for you. Well, this is a very small nodular melanoma. I cannot show hundreds of nodular melanomas because many times the doctors were not considering this diagnosis, and they removed the lesion without this diagnosis. So in our unit, we have many primary tumors, but pictures of nodular melanomas are difficult to be available. And this is the same in all the melanoma units, because many times doctors take this as dermal nevus, SEPK, different tumors, benign lesions, and they're removed even without histopathological analysis. Well, this is a small nodular melanoma that if you are tired, is the last patient in a very long day, maybe could be misdiagnosed. And dermoscopy in this case is exhibiting clues that we will review, but this is important because if you put your dermatoscope in this lesion and you are always looking at dermal nevi, you will see that here the lesion is different, even if you are not an expert, because of this pink coloration. This is the milky red coloration, and these vessels that are clearly atypical and different of what you expect to see in a dermal nevus. But this is a very unique tumor to have in a picture, because many times these tumors are removed without pictures. Mm-hmm. It's important to consider that you are dermatologists, maybe some of you are also dermatopathologists, but you are working with your pathologist. And the final diagnosis for the patient, should be the result of your pathologist and, of course, also your diagnosis. Because sometimes you receive a report with a different diagnosis, and sometimes it's difficult because what we call nevoid melanoma, many times is misdiagnosed in pathology, sometimes as a benign lesion, also in pathology. And then you have to call your pathologist and say, maybe we have to reconsider this. In a referral center, it's not a problem. But when you are working out of a referral center, you have to have this into consideration because it's another problem that we detected in diagnosis in melanoma. And then you have to consider, maybe my diagnosis was not fitting with this pathological report. Maybe something is wrong, and I have to look at the pictures and review if everything is okay. Why I did a biopsy of a dermal nevus? If I was considering that this was not a dermal nevus, I should ask the pathologist about this and try to have a review of the case. Now I have some cases for you during this lecture. This is the first one. This is a young lady, a patient with a mutation in CDKN2A. This is a familial melanoma patient with this mole. This is. And this was, of course, a lesion that clinically, it was consistent with diagnosis of Sutton nevus, I don't know. Look at this dermoscopy. Wow, it's not so easy. It can be a dermal nevus, yes? In the context of this patient with mutation, of course, and with this halo, asymmetric halo, even though that this lesion exhibited a globular pattern and not very typical one, we decided to remove this lesion, and it was malignant melanoma, nevoid one. So you have to be very aware of these sort of lesions because they sometimes are looking like dermal nevus. This is nevoid melanoma. Again, another lesion in a lady without any important clinical information, but with this dermoscopic image. In here, maybe this is a dermal nevus also, but here we consider that this bluish coloration was not so nice, and because of this, we decided to remove. We thought that this could be melanoma rising in a dermal nevus. Do you agree? Yeah. Well, all the lesion is melanoma. Mm-hmm. All the lesion is melanoma. This was surprising, but this is clear. No dermal nevus in this tumor. Then, nodular lesions can mimic banal lesions, and this is very important.